One other point you mentioned earlier about cancellation rate. The cancellation rate to me has always been impacted directly at the eval. So when I'd have patients come in, talk about a plan of care, how long is this going to take? And I'd say, well, from what I see and what doc thinks, we think you're needing 3 times a week for about at least 6, maybe 7 or 8 weeks to get over this. So that'll be 16 to 20, 22 visits. And I always used an antibiotic analogy. If you went to the doctor for sinus infection and they gave you 10 pills, amoxicillin a day for 10 days, right? You don't just take 7 and quit because it's likely going to come back, your sinus infection, right? I like to use that antibiotic analogy with patients and say, hey, if doc gives you a 10-day run of amoxicillin, you don't just take 6 and then 3 weeks later you're sick again and call him back, well, that didn't work, doc. It's because you only took 6 of them. So same thing with PT. If you're prescribed 3 times a week for 4 weeks, your patients need to show up just like an antibiotic 3 times a week for 4 weeks, and hopefully that'll take care of it. Most time it does, but if you start missing 1 or 2, your patients start missing 1 or 2 a week, it's just very similar to the antibiotic. Have you heard that before? Have you heard that analogy?
I have, and I would say some of the successful strategies, that's a good analogy to give. Yep. Then your staff have to take action, right? Someone's got to change the behavior, do a behavior to make sure that that happens. So I would say some of the successful things that I see clinics do to make sure that all the antibiotics are taken is they will schedule the full plan of care at the eval. So I'm scheduling your 4 weeks of appointments. Here you go, Mr. Jones, you're good to go. If the patient misses an appointment, you are working and doing everything you can to reschedule that appointment within the week and capture that visit within the, if it's 3 times a week and they've only come 2, get that 3rd visit in. I've also seen a lot of the treating or the evaluation therapist will introduce that patient to the rest of the staff. So that way, if that therapist is on vacation or that therapist has to call in sick, the patient's like, well, I can't see anybody, but Matt, my therapist, no one else can fix me. No, our whole team is great. We all know what we're doing here. We're all going to know your name by the time you're done, even though you're assigned to one therapist, we can all help you. And that just makes it really easy and flexible if you need to share a patient to work in a eval in, someone's on vacation, someone's sick. All that stuff goes a long way to make sure that the patient really doesn't have any excuse not to show up. And when they do show up, just make sure it's awesome for them, right? Make sure they have a great session and they're getting better and you're an engaging therapist. Obviously, that goes without being said, but at the same time, sometimes it needs to be said.
Thanks for sharing your insights today, buddy. It's clear that watching the metrics is like having a roadmap to success for the clinic, right? So for any PT owners, clinic owners listening, even taking a few small steps to track your metrics can make a huge difference. And speaking of a deep dive, Martin Healthcare Advisors, we do offer an outside-in assessment. It's like getting a detailed blood work done at your doctor's office for your clinic. It takes a deep dive into your metrics for you, for your efficiency, gives you a comprehensive view of what's really going on under the hood, behind the curtains of your clinic. This is Josh Meyers, Tanny Crawford. You can email me at tcrawford@martinhealthcareadvisors.com. Thanks for tuning in. If you'd like to learn more, have any questions, feel free to reach out to me at the email or DM me on social media. Take care and keep tracking those metrics. Josh, thanks for joining today, bud.
Thanks, it was good.
Have a good day.